Good morning. On behalf of the Nutrition Society of India Mumbai chapter,
I'm just a minute wait now.
The blue chain that you are seeing.
Neha, are you on mute?
Yeah.
Ma'am, you can start now.
good
Ma'am, you are on mute.
Good morning, everybody. On behalf of the Nutrition Society of India Mumbai chapter, myself, Dr. Subhadra Mandalika, take great pleasure in welcome each one of you to today's webinar. As all of you must be knowing, the World Health Organization has given equal importance to mental health as that of physical and social health in the definition of holistic health. Mental health, including mental illness, including anxiety disorders and mood disorders, is a major concern worldwide, more so in the recent past, and in India is not far behind in sharing this. However, it's heartening to know that only half of those affected receive treatment, often because of the stigma attached to mental health. Research has shown that mental health awareness campaigns have yielded positive outcomes. The World Federation for Mental Health has initiated observance of 10th of October every year as World Mental Health Day, with the overall objective of raising awareness of mental health issues around the world and mobilizing efforts in supporting of mental health. Several factors, including genetics, environment, and also nutrition, would influence the mental status of an individual, and knowledge of these is very important to tackle it in the appropriate manner. Moreover, awareness of the role of nutrition in mental disorders, that is nutritional psychiatry, is very, very sparse. Hence, the Nutrition Society of India Mumbai chapter felt the need for an awareness session with evidence-based information on medical and nutritional aspects of depression. We are very, very happy to have Dr. Rajesh Sagar, an eminent clinical psychiatrist from All India Institute of Medical Sciences, New Delhi, and Dr. Tatiana Rox, postdoctoral research fellow and head of translational and educational stream at the Food and Mood Center for Deakin University, Australia, who will be deliberating on the topic with evidence-based information. We are highly obliged that both of them have kindly accepted our invitation to share their valuable expertise with us today. I now request Mrs. Chandni Chopra to introduce our first speaker, Dr. Sagar, and I also request Dr. Veena Yardi to moderate the question answer session after the talk. Over to you, Chandni.
Thank you so much, Dr. Subhadra, for giving me this opportunity. I would like to introduce our first esteemed speaker with the audience. Dr. Rajesh Sagar is a professor at Department of Psychiatry at the All India Institute of Medical Sciences, New Delhi. Dr. Sagar has done his MD from NIMHANS, Bangalore. He's an honorary professor at the Department of Psychiatry, University of Melbourne, Australia. He also chairs the mental health group of Global Burden of Disease, India. He's a member, Central Mental Health Authority, Government of India, and has served as the secretary of the same from 2005 to 2018. He's the honorary advisory for mental health to the Ministry of Health and Family Welfare. Sir has received a certificate of completion from Specialist Training Authority of the Medical Royal Colleges UK and the General Medical Council UK. He has been an expert advisory member for several organizations. Dr. Sagar has over 500 research publications and has a number of chapters and books. To his credit, he has lots of awards and honors. Sir has the membership of National Academy of Medical Sciences. He has received the fellowship of International Medical Science Academy and the Royal College of Physicians, Edinburgh, UK. Sir has also received the Outstanding Researcher Award as country's topmost researcher in psychology and mental health based on research output in Scopus. The topic of today's talk that Dr. Sagar would be sharing are the clinical perspectives of depressive disorders. Thank you so much, Dr. Sagar. I would like you to take over the session now.
Good morning to everyone, and thank you, Chandni, and my thanks to everyone, Nutrition Society of India, Dr. Subhadra, and whole team to invite for this important lecture. And first of all, let me just wish you all happy Dashera, Vijayadashmi. Those who all have joined us, I can see large number of people have joined in. So I welcome and my best wishes on the occasion of Dashera and Vijayadashmi. And this is a very important topic, though our World Mental Health Day was over on 10th October, but still we are in a month of World Mental Health Day. So, just to tell you that because since this is important in the sense that we need to talk to public and many professionals with regard to mental health issue, because the important slogan what is no health without mental health. So I'm very happy that you have chosen this particular topic on mental health, and which would be important for us to understand, and creating awareness is a very important thing, and I'm happy that I am part of it. uh, just to tell you that this World Mental Health Day is celebrated since 1992. The theme is chosen every year, and this year the theme was mental health for all, greater investment, greater access, everywhere, everyone. So what it means is that we need to invest on mental health. Now, just to relate to this current, COVID pandemic, the importance of mental health has gone exponentially, and in the same regard, many, those who were not having a problem, or even those who are having a problem, the problems have exacerbated, or even the fresh problems have come up, and a lot of issues are being discussed not only in India, all over the world. And this issue is so important the current time now. There has been what is being said that there is an epidemic of pandemic of COVID. At the same time, there is epidemic of mental health problems. So in the same context, you can see it is very important to discuss and talk about mental health issues. So today's topic, what we are going to discuss is on depression. So I will briefly talk about depression, and also will give you a glimpse why depression is important to know, what is depression, and so on. And maybe later we can take a question answer session. I will just share my slides. Yeah. So you all can see my slides. Just say yes. Yeah.
Yes, Dr. Sagar.
Okay, great, wonderful. So, okay, so the topic is clinical perspective of depressive disorder, because the whole theme chosen for this webinar is on depression. So I will be speaking on clinical perspective, and my co-speaker, Dr. Rox, will speak on, dietary and nutrition aspect. So, okay, so just to tell you what is depression, and because it is a common term which is being used, we are using, and it is a very important condition as far as mental illness is concerned. One, it affects the physical, mental, and social well-being, and also affects our day-to-day life, like sleeping, eating, and so on. And the important thing is that since our emotions have like a wave, you feel happy, you feel sad, so it affects how people think and feel about themselves. So it is not only the problem of emotions. So and we all know that emotions and thinking are related. So So thinking is also affected, other than your how you feel. And the important thing is that the symptoms persist for they are for more than 2 weeks, and the most important, it interferes with a day-to-day life and functioning. So the point is, it is not only the symptom, but also the effect which has on the functioning part, that also we need to know that it does have a serious effect on that. Now, this I call as a secret of depression, because many people are not aware of it. And always, whenever I take lecture, I do talk about this, and just to give you a glimpse and what depression is all about. One, it is very common. I think I will talk about that, how common it is, and it is a common condition, and more so, it has become common during this COVID pandemic. The other important thing is often missed. Now, when I say often missed, means that it is missed by the person himself, or the family, or even the doctors also, the general practitioner, medical doctors, for a number of reasons. So this condition may be missed by everyone. It can be often severe. I think that also we need to know that, sometimes we think, no, you will get over this. This is, not a physical illness, there is no fever, nothing, there are no problems in your X-ray and so on. Your blood tests are normal. So people think that it's just a mild condition, but it can be very severe. I think that is what we need to know. Often recurrent. So one episode does not mean that you will only have one episode. One episode means that you will also have a second episode, or even more also. So it can be a recurrent condition. But the good thing is, it is not hard to diagnose. You can easily diagnose. I think that again is very important from the perspective of doctors. And you don't require, when I say not hard to diagnose, means you don't require very complicated investigations and all. You just need to spend time with your doctor, and doctors will ask you a few questions, and it can be easily diagnosed. So it's not hard to diagnose. It can be very costly. I will talk about that. Some studies in US have done, there is a loss of about $1 trillion a year. How? Because of for a number of reasons. Because of depression, many people, they are absent from their work. If they are present also, then the efficiency goes down, the productivity goes down. So it's a loss of a nation as such. So the depression has a link with the economics of any nation. So one can understand, people have there is a calculation of more than a billion or $1 trillion a year. So you can imagine that how important it is, not only for the nation, but also for society and so on. But the good thing, again, I will tell you, it is highly treatable. I would say it's completely treatable if you identify early, and there are, you just be like a normal person. And it is a common myth that, there is no treatment for depression. I would say here, through this medium, it is completely treatable. I would say almost 100%. So that's a very good thing about depression. And don't go by the myths, misconception which are there, that it cannot be treated. So these are important secrets of depression. Now, with this context, I will just go on to talk about what the burden or what the magnitude of the problem is. And just recently, we had we looked at the data and the study, which was coordinated by ICMR and Department of Health Research, Public Health Foundation. IHME is in US, that is Institute of Health Metrics and Evaluation, where this was published in one of the top journal, Lancet Psychiatry, and this was called as the burden of mental disorder across states of India, the global burden of disease, 1990 to 2017, and this is available in the net, you can see. And this talks about, this is the only study where it talks about the burden of mental disorder all across the states of the India, So I will just tell you what the glimpse of this is, to tell you what the magnitude of the problem is in our own country, because till now we were getting data from other countries, international developed world, but this is the information from our own country. So about 200 million people are affected. I'm talking of mental disorders here. Of the 14.3 of the total population had mental disorder. Now, this is about mental disorder, but if you can see, depression or depressive disorder were about close to 45 million. So one can say around 5% or so. prevalence of depression was related to suicide deaths, more in female than male. So again, what it says here, that depression is linked with suicide. I think we know that, and that is why again it is important when I say severe. It means that because depression is linked with suicide as well, and it does depression contribute to the total mental disorder disability, overall disability. Depression has a major contribution. It is important to know that females are almost 2 times more common as compared to male. And this is there all over the world, in the community. But the flip side is that females seeking help is lower than the male. So that is why it's important that to look at depression in females. Higher prevalence in older adults, and these are some of the states where it's high prevalence. And so these are just some just to tell you briefly about the burden or the magnitude of the problem. Now, if you see, because again, these are some of the internet studies by WHO and a World Bank, which have done. And earlier it was slated that depression is ranking 4th. Then in 2020, the projection was it is number 2 disorder. Like here also you can see that just to if you are not able to see, these are the top conditions of YLD, means years lived with disability. I'm trying to link that how much disability the depression can cause. And this left side you have the column of the ages, the bracket is of age, and you can see in the x-axis it's a ranking 1, 2, 3 up to 10. So here you can see that 20 to 24 age group, it is number 1 condition as far as a disability is concerned. So you can see that in that age group, that's a number 1 condition. And majority is number 2. You can see the ranking in number 2. Like you can see that as compared to other medical condition like back and neck pain, skin, migraine, and other asthma, diarrhea. So all conditions are here. So you can see in majority of the age group, like 15 to 19 and 45 to 49, that age group, it is 1 or 2. So you can see that's a prime age group. Depression is ranking number 2, and in some older age group, it is in ranking number 4, and so on. So you can see that as far as all conditions are concerned, the disability which is caused by a condition, any medical condition, depression ranks number 2 in the current state. I think this is not mine. This is based on the evidence which is available. But at the same time, it is important, the projection for 2030, again, this WHO talks about depression will be the leading cause of disability. Now, this is very important. That is why we need to have such type of discussion, what we are having today, that this is going to be the number 1 cause of disability, when we talk of all medical conditions. So that is why we need to prepare ourselves now. And also, I just want to tell you that it is not only a condition of developed world or Western countries. It is also there in our own country, developing countries. Only thing is that the people do not come forward for number of reasons, because of stigma, discrimination, and so on. But the point here is the projection for 2030 is the leading cause of disability, and that is why we need to have such type of discussion more often. Now, just to tell you that depression is also there. It is because since I work closely with young population, youth population, so depression is also there in very much there in children, adolescent population, and and different figures are there in Indian population also. Up to 14% of children, it may have the depression may be there. Again, depression in children and adolescents, again, there are multiple somatic complaints. Somatic complaints means that a young person will complain of abdomen pain, body pain, and so on. So that's what tiredness. So these are what we call as a somatic complaint. Low mood, decreased interest in play and activities, excessive tiredness, low self-esteem, and problem with concentration, and there may be anger or aggression. But the important thing for children is that there is a deterioration in school performance. there is a poor school performance. So that is a very important thing that we need to know, especially when we talk of youth. There may be death wishes also, even suicidal behavior. We all know that how important it has become in recent times, especially in the event of exams when the results are out. So you can see that this is a very, very vulnerable group. And again, it may be there are issues of substance use. There may be high risk behavior, like driving, and there may be rebellious behavior. So all this may be possibly linked to depression. So in young population, it may present differently, but more importantly, the problem related to poor school performance. Even what in our study, what we also found, even the school refusal is there as one of the key symptoms. That children who are have depression, they do not want to go to school. They do not like a school. And also here, I would like to say that one of the important thing in young people has come up is the bullying. Bullying, which is not only the concept of Western countries, but now in our country also, bullying also has a major link with depression. So we need to be aware. And of course, there are the risk factors are there: death in the family, change in the residence, and any relationship issues, and failure in the exam. So these are some of the issues related to children and adolescents. Now, these are some of the studies what we have done in the department, and our PhD thesis, and we looked at the computer-assisted cognitive behavior therapy. It's a very important kind of a therapy which is given, and this was on Indian adolescents with depression, and we found that this therapy can be used and very effective, especially for young people. And this again is the information from our own department that it talks about the depression in our own OPD clinic, how much it is. Again, it's published in important journal in India, and children of less than 16 years of age, done in some time back, 2010, that it's around 4%, more than 4%. And mood was depressed in about around 52%, and the irritability was there around 34%. So you can see that's how they present. And also there were about 13.2 had a suicidal ideation, and around 29% had comorbid psychiatric disorder. There was other psychiatric disorder also. Had a problem with the concentration, anxiety, family history was also positive. So again, this is the information from our own department and from our own country. So this was depression in young population. Now depression is also there in older population, elderly population, which again is very important. And almost it is said that elderly people who visit OPD, about 1/3 of them, they do have a depression. So you can see up to 45%, 46% may have an elderly population, may have a depression. So you see that how important it is even for elderly population. And of course, there are many psychosocial factors like, many life events, financial problems, or death in the family, and so on. So these may be some of the important risk factor for elderly. So so these are some of the important vulnerable group, children, elderly population. Then in women, also, as I said, it's a 2 times more common in women, and it is important cause of disability in women. And postnatal depression, again, I will talk that later more in detail, around 11%. Symptoms are again postpartum depression, infanticidal ideas. To infanticidal ideas mean that doing harm to a baby. Those thoughts comes to the mind. So it's a very important condition. Postpartum depression. Now, these are again some of the important work which of our department. I'm just giving you to give a glimpse backed by some of the evidences what we have. We looked at the psychiatric morbidity, our department, community medicine department. This was a research work for the mobile health clinic in the urban community, where importantly, it was found that about 16% there was a depression, and it was the most common psychiatric disorder, followed by general anxiety disorder, phobia, and so on. And of course, suicidal ideation was reported in about 11%. So you can see that even in the mobile health clinic, depression is one of the important, almost 16% of them, they do have depression. Now, this is a very important study by WHO country, where it was done in 60 countries as a part of World Health Survey. And you can see that 1 year prevalence was 3.2%, and 23 up to 23% when it was associated with chronic condition. So you can see that how prevalent it is when we talk of worldwide in all in 60 countries. And it produces that's a very important point. Depression produces the greatest decrement in health compared with a chronic disease like angina, arthritis, asthma, and diabetes. So you can see that the decrement in the health, overall health, was much more in depression as compared to other medical conditions. This is based on this worldwide study comprising of in 60 countries. Now, the point is that why do we need to understand depression? And one, by now we know that it's a major public health problem. There is no doubt about it. And, and is one of the top, now also we know that it's one of the top causes of disability, of illness, a burden in world as well as in India. And it has a high cost to society. And these are the calculation, 40 billion US dollar in direct or indirect costs. As I said, because either people they are absent from work, their efficiency goes down, their productivity goes down. It's a general thing, like whenever we feel depressed, if you are coming to office, you don't feel like working, your efficiency goes down. So and that is how people have some of the research have calculated that how much detrimental it can be. And depression is again a risk factor of society. We need to know that up to 15% of them may commit suicide. So you can see that, such an important number with regard to suicide. And it also, the link with the physical illness like diabetes, cardiovascular illness, or stroke, or, like a brain stroke. So diabetes, again, it's a poor adherence to the dietary and medication regime. I will talk that more in detail. So in diabetes, also a person who has depression, the dietary regime and medication regime are also, there is a poor adherence. Cardiovascular illness also, the mortality is 2.5 times higher, those people who have a depression versus people who do not have depression. Again, a depression and stroke, a person who has a depression has a double the risk of stroke. There are 2 times the risk of stroke is there. So you can see that, depression has a link with the other physical or medical illness. And in day-to-day functioning has a significant impact. As I said, decrease the attendance, performance of work. And you can see that these are the numbers which are given. Of course, it is an important predictor of poor grades in school and, substance use and so on. And but the important thing is, because sometimes whenever we take public lecture, we do talk about some of the myths and misconceptions about depression and other psychiatric illness, because that's a major barrier. And you can see that there's a poor awareness about its cause and effects, about depression, and also in general psychiatric illness. Up to 70% believe that it's due to emotional weakness in some of the studies. So it's people sometimes say, you have to get over it. We will take you to, some hill station, you will become fine, and so on, because it is not considered as a true medical illness. That's a major flaw, because sometimes the family members and others say, no, you are just feigning, you don't want to go to office, or you don't want to go to school, or you don't want to go to a college. You are just making up for that, like in physical illness, we have a pain, we have a fever, that's a more objective, your blood pressure is high, you can see that. So here, it's not considered as a real illness. So that's a major problem with that. And a person who has a depression, he or she only knows how much distress it is causing. I think that's a very important point as far as psychiatric illness are concerned, or even depression is concerned. As I said, it's highly treatable. I think different type, medications, we have all kinds of medicines available. There is a role of psychotherapy. Even there are other modes of treatment also. And treating depression reduces the cost of management of other illnesses like diabetes. What it means is that if you treat a person effectively with depression, the overall treatment cost of diabetes also goes down. Because as I said, because if you take care of depression in a person who has diabetes, then overall the quality of life will improve. Easy to make diagnosis, as I said, no need for sophisticated investigation. Early intervention, again, it reduces the reduction in the episode or the severity or the impact. So with all these reasons, I think it is important that we need to talk about depression and need to understand the depression. How can we now? This is a very important slide I just want to show here. That commonly we just say, I am sad, I am sorrow, but that does not mean a person has depression. Depression, when we psychiatry professionals say when we say depression means a clinical condition. It's a clinical depression. So how they are different? Like if you can see the graph here, like majority of the people in the x-axis, you can see, depressed mood, a depressive episode. Then the y-axis, you can see, low to high. That normally normal mood fluctuation are to almost all of us. We all go through normal mood fluctuation. So it does not mean that we all have a depression. But if you can see the middle column, there is a sustained mood change. So there are about half of people have this, but if you see the other right side, that is sustained mood change, which is there, that is actually a depressive episode. So sorrow or sadness means it's a feeling of deep distress caused by loss, disappointment, or other misfortune suffered by oneself or others. Like it's maybe just a normal emotion or ubiquitous, which is there all over. Then it is just a temporary, which is just a transient phenomena. It is less intense and rarely affects or there is no effect on functioning. Whereas depression is a persistent, as I said, more than 2 weeks in all aspects of life, does not affect everybody. And so only few, as I said, the prevalence would be around 5% or so, and incidence just warrants a treatment. So this is the group where you actually need a proper treatment. If you don't do the treatment proper, then it may have a serious consequence. Okay. Now, with this, I think I will just talk that when I said that of depression, when we make a diagnosis, it's very simple to make a diagnosis. In fact, there are some checklists which are available, but the best would be to talk to a doctor, because doctor will interview you, talk to you. Of course, there are online methods also available. You can check yourself. When we do advocate sometimes, self-help measures, self-management, you can see your own symptom. So there are certain major symptoms and minor symptoms. I think, and the major, as the term depression, it's effect of mood. So it's a pervasive low mood, persistent pervasive low mood. What I mean by persistent means that it has to be, as I said, more than 2 weeks. It should be present. When we talk of 2 weeks, it should be on most of the days in 2 weeks. It should not that after in these 2 weeks, only 2 times it has happened. It has to be persistent most of the time in these 2 weeks. Pervasive means it is there in all situations. Like, it is there at home, it is there at workplace, wherever you go out. It is not only there at one place. So it has to be persistent, pervasive, low mood. Low mood is one of the important features. Anhedonia means lack of interest. Like, say for example, you are watching TV, you are, now you are not doing it. Now you are not doing the, things which were making you feel pleasurable. That is not there. Even if you are sitting in front of TV, but you are not enjoying it. So that is anhedonia. That is lack of enjoyment. It is one of the important symptoms of depression. Then the other important symptom is, as I said, as a part of physical symptom, that's marked tiredness and easy fatigability. So these are some of the 3 major symptoms, out of which, if you see, it is not necessary that you have to have a low mood all the time. To make a diagnosis, you need to, out of these 3, 2 should be present. So practically, if you have anhedonia and tiredness, then also you can make a diagnosis depression. You need not have a low mood to have a diagnosis of depression. So that's what I want to highlight here, especially in our culture. Sometimes low mood may not come up very strongly because people do not talk about it so commonly to everyone. But more common would be, and a different culture had different ways of expressing it, like man bujha hai, there are different local parlance of using the language. So, but the key thing is that there would be lack of interest, tiredness or fatigability or low mood. Out of these 3, 2 should be present. And the rest are the minor symptoms, like, reduced concentration and attention. That is a very common symptom. Like, like in office, I'm not able to concentrate. While studying, I'm not able to concentrate. Any activity, I'm not able to focus myself. And this again has become very common during this COVID pandemic also. A lot of people are coming to us saying that I'm not able to concentrate. So because many things are going around us, that also making us to, when you are doing multitasking, that also reduces your concentration. Reduce self-esteem and self-confidence. It is one of the important symptoms that there is a lack of self-confidence. Ideas of guilt, I have done something bad, that is why God is punishing me. Unworthiness, pessimistic views of future, bleak or pessimistic, there is nothing left for me in the life. There is, there is a pessimistic view, strong pessimistic views. Acts of self-harm or suicide, these are something very serious, which may be part of depression. Then again, disturbed sleep or decreased appetite may also be there. As I said, a depression cannot be made based on just one symptom. You have to have a cluster of symptoms. It's a syndromal diagnosis. You need to have a group of symptoms. That is why we have to make a categorize that mild depression. You need to have two major, like out of these first three, what I have said, out of two should be present, and out of these rest, seven, again two should be present. For moderate, 2 and 3, and then again somatic syndrome. Then severe, again 3 plus 4. So again, there is a different variation is there. So to minimum 2 plus 2, so if they are there, then the diagnosis of depression is made, But the point, what I'm saying is severe, then it requires immediate hospitalization. There may be serious risk. That is why, if there are more symptoms, then it can be a serious problem and it requires a more aggressive management. Then causes of depression, I think many times we do discuss that, because for any psychiatric illness, what we call as a general rule, it's a biopsychosocial model of etiology or causes. So there are biological methods, biological and psychosocial, and as mentioned that environmental factors are there, stressful life event like death, or moving out, or new job, any relationship issues, and so on. Psychological factor, one who thinks negatively about self, or one who is so obsessive, and one who see negative about self or the world. And there are important biological factors like genetic predisposition, family link. It is said that 10 times more common if someone in the family has depression. And the important is there are neurotransmitter abnormalities. That is why we give a medicine to a person to correct these neurotransmitter abnormalities. So that is why you can see that causes, it's a biopsychosocial model. So there are important biological factors, and also there are important psychosocial factors as the causes of depression. And these are some of the important risk factors, which I will just mention here, that childhood sexual abuse, partner violence, bullying, as I mentioned earlier, chronic illness also is a risk factor, social isolation, inadequate social support, elder abuse, prior depressive episode, family history positive, age of less than 40 years of onset, medical comorbidity, stressful life event, and so on. And the list goes on: prior suicide attempt, current substance abuse, life events, poverty, again, parental loss, parental disharmony, especially in the context of young people, eldest birth order, a family history of mental illness, interpersonal relationship difficulties. And so these are some of the important risk factors, and it's important for us to know so that we are aware of it. Now, the important thing is depression has a link with a physical illness. Physical illness means diabetes, cardiovascular illness, stroke, and other medical illnesses. And important is that it can, when the depression is associated, it can increase the morbidity. The illness severity may be increased when you have a associated depression in any of the illness. There are issues because if a person has depression along with the other cardiovascular illness, the mortality risk increases. Again, there are reasons behind that. And also a person who has a depression along with any other medical illness, the hospital stay also may be increased. Cost of medical care may also increase. Compliance with medication may also be affected. Like, say, for example, a person has a depression and diabetes. I am giving the example. If a person has a depression, then what will happen? The care for the diabetes, what is being taken care, like the medicine one has to take, the physical activity one has to do, exercise one has to do, and also diet restriction which are to be there, they all will be affected when a person has a depression. So you can see that there is a direct link as well as indirect link with any physical or medical illness, and overall quality of life may be reduced when a person has associated depression. So one can see that depression has can affect in number of ways in any of the physical illness. It can, of course, increase the risk of, a depressive episode. And so what I'm saying is that if a person has a physical illness, can also the risk for depression also increases. So in a way, depression and physical illness, they have the bidirectional relationship. And that is why it is seen that in many of the medical conditions like stroke, myocardial infarction, cardiovascular pain, chronic fatigue, diabetes, so there are up to 15 to let's say 40% increase risk of depression is there, and sometimes up to 40% associated depression is there in these medical conditions like hypothyroidism, vitamin B12 deficiency, and other conditions. So because of the chronic nature of illness, the risk of depression also increases. So you can see that there is a bidirectional relationship. So what it means that physical illness, they increase the risk of depression, and one who is a depression increase the risk of physical illness. Somatic complaints in depression means these are the physical complaints of depression, because since I'm not discussing mind-body relationship, they are unitary concept, they are not too different. So whenever our mind is affected, there are bodily symptoms in that, and vice versa. So in depression, typically it's seen as psychological condition, but there are physical symptoms also in this depression, like chronic joint pains may also be there. Sometime, I will just give you an example. A person has been gone to many places, many doctors has visited. They have such a big file, of all the investigations. But when they are finally referred to us, we find that they have depression, and we treat them, and person becomes absolutely fine. And sometimes they have gone through many doctors, many other places, and got hundreds of investigation with such a big file of investigation. And but underlying they have a depression which has not been taken care of. We just treat a depression and everything becomes fine. So this could present like this, joint pain, limb pain, back pain, gastrointestinal problem, tiredness, sleep problems, appetite changes, and so on. In dementia also, it is important for us to know that a person with a dementia can also have a depression. That is what we need to see. And that is why all dementia patients, they have to be routinely screened for depression, or any person in elderly, more specifically need to look for depression. As I said, 1/3 of them may have a depression, but dementia specifically also have a link with the depression. Cancer again, because it's we know that it's a very important condition, and depression is highly related to that. And because of terminal ill cancer, sometimes it can have a negative impact on quality of life, and there are high rates of depression. And not only because of fear about death and dying and so on, uncertainty which is there in a person with cancer, even it is important in the caregiver also, because any, like say for example, a caregiver who's taking care of a family person who has a cancer or even dementia, they are also at high risk of depression. So that is why it is not only important to look at in the index person, but also in the caregiver, because they are also at increased load of the stress and so on. So they may also have a burnout, which also may be there in the health profession, more so in the current situation, COVID pandemic. So you can see that there is a high risk of depression in these vulnerable group of people. Postpartum depression, again, it's a very important condition. Whenever we talk of women, it begins soon after birth or continues at the antenatal depression. There is a depressed mood or severe mood swings can be there, excessive crying. The problem, because here in postpartum depression, as compared to other depression, is here there is a involvement of baby also. There's a mother baby as one unit. So there is a difficulty in bonding with your baby when mother has a depression, or withdrawing from family or friends. There is loss of appetite, inability to sleep or sleeping too much, or loss of energy, reduced interest, fear that you are not a good mother. There may be hopelessness feelings, feeling of worthless, diminished ability to think clearly, restlessness, and there may be thoughts of harming yourself or your baby. You can see recurrent thoughts of death may be there, or suicide. Then there could be a risk factor for which again could be financial difficulty, domestic violence, marital conflict, and so on. Again, can lead to chronic or recurrent depression. There may be issues with mother-infant relationship, may not breastfeed the child, and can lead to psychological problems also in a child up to the age of 10 years. So here you can see the depression mother can have a harmful effect in a baby also, you can say, and that is why it is important to recognize and treat depression in mother. And diabetes, again, we know the link, it's a strong link is there. And there is as already mentioned, that risk of developing depression is increased with diabetes. There are problems related to poor diet, medication regime adherence, impairment of functioning, and there is higher healthcare cost and so on. Again, there is good evidence all over the world about it. And chronic illness with additional medical cost, and constant vigilance in terms of diet, which is important when we are talking in seminar of nutrition experts. And depression again can lead to a diabetes treatment non-adherence. And these are some of the studies what we did, and we also found that diabetes there is a high chances of anxiety and depression. And this is the important study, in fact the only study from our country which has been published recently in one of the top journal. In fact, Chandni was part of this study, and where also it was found that depression and diabetes are related. In fact, the best model I can see is the ABCD. A is HB1AC, B is the blood pressure, C is cholesterol, and D is for depression. And we need to look for depression, any person who has diabetes, because as I said that there is a bidirectional relationship with regard to diet regime or treatment adherence and so on. Okay, now I will just spend a few minutes on this, the management part. The important goals of management is education. We need to educate family and the person. And basically, we need to we aim for a remission, relieve the symptoms of the present episode. And also we need to look at so that there is a prophylaxis so that future episode does not happen. And frequent follow-ups are important. That's what the message I want to give here. It's not one-time visit to a doctor. You have to visit on regular basis. We need to restore the functioning which was there earlier, and basically to prevent the relapse of the future. Minimum treatment is given from 9 to 12 months. That's most of problem what has happened that when you start the treatment, suddenly the because of treatment you become fine. You are in remission, your symptoms goes down, but suddenly because of this you stop medicine, which is not advisable. It should be in consultation with your doctor, because a doctor has to continue medicine for some time so that the future episode does not happen within this 6 months period. So that is why it is important to have the continuous medication, and be in regular touch, follow up with your doctor. Antidepressant are the first line of treatment. Of course, there is a combination of medicine as well as psychotherapy. A whole lot of psychotherapy. The important one, cognitive behavior therapy, is there too, which reduces the risk of relapse, enhance the quality of life, and they are very effective. And these whole range of therapy which are available for the treatment of depression. We need to see that patient characteristics which influence the treatment adherence is basically their attitude and belief towards the disorder. So what is seen that the success of the treatment lies that how much positive attitude you have towards the treatment, and the belief with regard to medication and so on. Doctor-patient relationship again has a value with regard to the treatment outcome. And but at the same time, there many patients have the erroneous belief, and they have a misconception with regard to treatment, like these medicines are hot and so on. They have a lot of side effects, and a lot of myths and misconceptions are there, and which again lead to relapse early and can have a serious implication. So it is important when we talk of management, we need to create awareness and education. I think that is why we are having this kind of seminar and webinar, talking. And I wish, we have been part of doing many such in the past, but we need to do more, more. We need to create awareness in people, because what is important that, like Western countries, anyone has a good health literacy, but here we are talking mental health literacy. Awareness about the mental health issues of self are important, because whenever you have a problem, you have to raise your hand. People are there around us to help you. So your self-awareness is important for any illness, more so for psychiatric illness, and that is why such importance of creating awareness is there. That is why we do discuss in media, we do discuss, to create awareness. I think that's a very important issue. And in recent time, it's positively we have seen that, the awareness has been there for mental illness. Sensitization of healthcare professional, I think again it is important, and we need to discuss not only, and also let me tell you, many healthcare professionals are not much aware of psychiatric issues. Enhance the pool of care provider, again that is important. Removal of stigma, again, which itself is a different topic for discussion. increase availability of clinical services. I want to give a message here. If anyone has a problem, one should not wait to see a psychiatrist. One can go to any doctor nearby, any health center or primary health center, or any or health and wellness center which are there, which are government aided, where you can, if they are nearby, so any doctor can you can talk to your doctor, and the treatment can be provided there itself. Regular supply of medicine is important. And here, in the context of nutrition seminar, I would say the removal of malnutrition, obesity is also important. And in fact, we have worked in the area. Obesity has a strong link with depression also, and suicide prevention program. Okay, just few slides about prevention. I will just take few minutes. How much time? I think I will just take few minutes now. Because since I am talking in the conference of nutrition experts, Nutrition Society of India, and these are the evidence-based. In fact, some time back, I did talk in one of the WHO conference. So there is a role of prevention of diet, and these are some of the important protective factors. Intake of fish and olive oil, and it does have a negative effect on the severity of depression. And there is a benefit is there by controlling all confound. In fact, one can look at this study, which is the Mediterranean diet also is found to be protective. And higher intake of EPA and DHA, and micronutrient intake again has a protective of folate, tryptophan, zinc, iron, B6, B12, selenium, and so on. And these are some of the risk factors: lifestyle, diet-related consumption of sweets, fast food, processed pastries, meat products, full fat, dairy, substance use, And these are the obesity. As I said, obesity is an important predictor of depression, odds of 1.5, and depression is a predictor of obesity. So it's a two-way relationship, 1.4. Sleep is also important life factor, and as a prevention, 90% of patients report insomnia. So, good sleep is important, but it is said that people who do not sleep properly, they are at high risk of depression, So, and there are inflammatory mediators process, and there are neurochemical changes also, with regard to poor sleep, which leads to depression. Exercise has a good prevention role. I think a message I want to give here: exercise has a good prevention in depression as well, and in obese people also, moderate to vigorous exercise reduce the risk of depression. Effect of exercise are more pronounced in women and those over 40 years of age. Exercise has therapeutic effect in cases of depression, and the mechanism is also there: anti-inflammatory action, increase brain tryptophan, regulation of HP axis. So these are some of the mechanism given based on some of the, and there's a good evidence available for this. And these are some of the other factors, like avoiding smoking, alcohol, enhanced social networking has a very important role. Encouragement of hobbies, recreation, pursuing interests. Always I advise in my OPD card, to continue with your hobbies, interest, playing sports, games, and so on. It has a very positive effect on depression, either as a prevention or controlling also. Environmental factors, manipulation, even being in the nature, and so on. Again, that has a good role to play, but again, they cannot substitute for the treatment, but they may enhance, as add-on. Stress reduction, yoga has a very important role, meditation, and some relaxation exercise. Okay, so just to conclude, I think my time is also getting over 11:30. So I think take home message: depression is a common and debilitating mental disorder. It is one of the leading cause of the burden and disability in India and world. Involves biological, social, and psychological factor. It's an easily diagnosable condition. It's some silver lining. Need for early identification for effective management. Effective treatment modalities are available for depression, and lifestyle style factor does play a protection role and also predisposition for depression. With this, I will end here. Once again, I will wish happy Dashera, happy Vijayadashmi to all. And we know that during this on this day there is a win over evil versus I hope that depression as an evil will go away, and and we take care of this evil in everyone's family or oneself, and hope this evil is taken away on this important day of Dashera. Thank you all.
Yeah, thank you, Dr. Sagar. It was a wonderful session. And you have covered almost everything. I don't know how you have managed in such a short period of time. I mean, you have talked about that, how this common psychiatric disorder, depression, what it means, what are the causes, what are the preventive strategies, how to manage, among whom it is common, which age group, adolescent, children, women, then why women have it common, why and they don't go to the psychiatrist or any other for treatment. Then you have also talked about the statistics also in a very interesting way. And so you have covered almost everything, but yet we will need to know much more. And I'm sure Dr. Subhadra will agree that we need to have one more session with you, because definitely you have, this topic is something which, we don't give much attention to. Like all other physical symptoms about, like, recently because of some film personality, or even in yesterday's paper, some film actress talking about her daughter going through. So, people, there is more awareness. And then, it is openly talked now, at least gradually. So, you have covered it beautifully, everything. And what I like most is that you said that it can be easily diagnosed and highly treatable. And so people should not hesitate. And the symptoms also you have given very well. So, it could be similar symptoms, but because of some other conditions, but going at the right time to the right person like you, and then finding out is very, very important. I think there are a number of questions, because some I have on Zoom chat we have received, some on my personal chat I have received, as well as on YouTube. And so, there are certain questions where, in between during your session, some questions were sent, but then you answered later. So I'm not going to take those questions. Then there are some questions which are related to nutrition, which I'm keeping it to the next speaker. And so there are a few only I will able to take. And then there are still remaining. So if you permit later on those, our chapter can send it, mail it to you, and you can give the answer. And so it can be, forwarded to the people who are saying. So, sir, first I would like to begin. I mean, as I said, there are a number of questions. Has genetics any role to play in depression?
Yeah, that's a very good question. And in fact, I briefly touched upon it. And as I said, that the model is a biopsychosocial and biological. When we talk, genetics does play a role, but here it is not like genetics that everyone will have. The risk is increased always whenever the patient, when they come to us. We only say that, okay, some amount of risk is increased, 10% maybe risk is more, but it does not mean that in the family, if anyone has a depression, definitely your children will also have, or anyone will have. It is only that risk increases because anyone, and that is why whenever we take a history, we talk to a person or the family, we always take a history, whether anyone in your family, did they have any psychiatric illness or depression in particular. So we always note it down because the risk is more, and but again, I don't want to give a fear to everyone, that it does not mean that anyone in the family who has, the other family member will all definitely have. No, it's only some risk is increased.
Can there be some, depression is caused due to side effects of some medicine, which are taken for some other treatment?
No, that's a very good question. I think that's a very important, though, because I did not touch here. And there are many medicines are there. In fact, if you see that many of, I can give you some example, like medicine like steroids. If you see, steroids can cause depression. There are many medicines which take care of your hypertension, hypertension, antihypertensive, which are there. If you see there, list of side effects, the depression is one of them. So there are many medicines, and there are many other medicines also which may cause depression. But only thing I will tell you that you should not worry much about it, because anyway, if the medicine is necessary, you will have to take medicine. Then only thing, if you have a symptom of depression, then you should consult your doctor. You should talk to them. Then some alteration medicine can be done. If not, then the treatment of depression can be given.
Right. Can depression affect the efficacy of medicine that is given, say, for diabetes or for cancer? And if person is depressed, then will it affect the treatment?
That's again an important point. As I said, that any physical illness or medical illness, depression plays a major role, with regard to, already I talked about the medicine adherence and their own, because ultimately what we have to see, if you allow me, that for any illness, to get over the illness, you need that mindset, you need that motivation. And say, for example, if a person has, let's say, a cancer or any other, you have to go to a doctor. You have to be motivated to go to a doctor, wait for a doctor. You have to take appointment from a doctor, and you have to take medicines every day. So some level of motivation is required. Some level of, is required, that I have to live. I have to, get over the situation. But what happens in depression, some of those, that motivation is lacking. You don't feel like, because there's a lack of interest. There is some kind of lethargy. So that can play a part in your physical illness also. So that is why depression does have a role in any other physical illness. That is why we always say, whenever it is there, so it is important to treat aggressively for the depression also. You can't leave like that, because it has a link with the other medical illness. So if, yes, I think there is a link with any kind of medical illness. Some of them already I touched upon in your presentation.
Yes, thank you, sir. There's one question. Sometimes similar symptoms are seen during PMS or hormonal imbalance. And is it considered as clinical depression, or sometimes discrimination and disparity in society or behavior of people around you, like shaming or judging or nasty comments affect you? Is it considered as a clinical depression?
Again, that's a very important point. In fact, I have not touched upon, the social media and how much it can affect you. Like some of the terms which have been, have come up in recent time, body shaming. We have reported in some of the newspaper, and also faced some terms like Facebook depression, how much likes you have. And, but one thing I can tell you, that this social media has do affect us, especially young people, and it can seriously affect them, the negative comments and all, and it can be sometimes very serious. I just want to tell here again, and also this depression is also common during PMS phase, and those are well described, they are there, and some of the mood changes are there. But again, I want to highlight here that depression is not just a sadness. To qualify for depression, you have to have a group of symptoms. As I said, minimum 4 symptoms should be there. If you have 3 symptoms, then again, you will not call as a depression. So minimum 4 symptoms should be there. And again, I categorize 2 major and 2 minor like that, So that has to be there. If it is not there, you will not call as a depression, number 1. Number 2, it should be more than 2 weeks. Again, if it is there for 1 week, no, there is no depression. Then again, it has to affect your day-to-day life. Your functioning should be affected. So when all these are fulfilled, when I showed that slide, that it's sadness does not mean all the time it's depression. Of course, it can lead to depression, but to qualify for a clinical depression, you have to have all those criteria.
Right.
So if it is there, then yes, it is depression.
Very true. Thank you. It's also asked, like, is prescribing antidepressants the first line of treatment for all? I see many patients who suffer further because these medications change their physical appearance. This undermines their self-esteem and confidence, and thus social interactions.
Yeah, I think I just want to give a message here, and which is commonly discussed. And in fact, I did have a few, message for some of the myths and misconceptions about, mainly about treatment. Psychiatric treatment, and more so treatment for depression. Now, I want to tell you that some of the medicine for depression, they are much, much safer, even as compared to the common medicine like Disprin and all you take, even safer than your Crocin also, so one that, and they all have been tested all over the world, but there are a lot of misconceptions, myths, like these medicines are hot, and so on. They will cause this, they will, increase the weight. Of course, there are medicine, but at the same time, now we have very up to date, very, state of the art medicines are there, which does not cause a weight gain. And some of those side effects are taken care of. Taking antidepressant medicine is like choosing your car. You can choose out of 30 cars that which one I have to take. Similarly, antidepressants are also like that. There are a number of antidepressant medicines available. Based on the profile, based on the side effect, based on the past response, we choose them. If there are problems, then we'll give another one. But as far as we know, of course, any medicine will have a side effect. There is no medicine which does not have a side effect, but we have to, any doctor will have to see the ratio, the risk and benefit ratio. If the benefit is more than the risk, then that treatment is given. I just want to give a message here that if you don't treat a person, then see what the consequence could be. Person may commit suicide. So that is why we need to be very serious about treatment of depression. So if at all you have some changes, but at the cost of life, then it's something good. That means the benefit is more than the risk. So we have to see that something, if you have not treated this person, then what would have happened? So that we have to see, think
How
about.
do you identify depression in children? Because
Yeah.
you also said children also get affected.
Yeah. If you have seen my slide, I have mentioned that very particularly. I have talked about it. In children, there is a problem related to their school performance. Their performance goes down. They may be cranky. They may be tearful. They may be problem in sleep. They may be fearful. They may have older adolescents may have have a risk-taking behavior, some behavioral problems, some let's say defined behavior. So all these may be there, which is slightly different from adults, because here the main issue, even school refusal also, they don't want to go to school and so on. So we need to talk to them, because sometime in children it is difficult to interact with them. But if you have good rapport, then they open out, they talk about it. And if it is there, if you treat them, they become fine.
Is it necessary to go to a psychiatrist only, or we can go to counselor also if there is depression?
That's a very good point.
Because there are counselors also.
I would say because as in my presentation you have seen that in the diagnosis of depression, when we make a diagnosis, we also have to look at the other medical condition also, because there may be other medical conditions, sometimes they may be linked. So if you want to make a comprehensive diagnosis, the medical doctor, I would say, and they are available nearby also. Maybe psychiatrists may not be available. And for a thorough checkup, you can go to first, if you want to have a complete checkup, say want to make a diagnosis, want to rule out other medical condition, then the medical doctor is a person. But if you know that your doctor has seen everything is okay, then doctor has advised, okay, now you can go for a counselor for sessions and all, then you can go to a counselor, depending on which stage you are in. And you can visit a professional. But I would say that anyone who is available nearby, you take a help. And I understand that medical doctors are available nearby easily, so you can talk to them. And if your doctor says that you can go to counselor, yes, I think you can go to them also.
Right, thank you. One question is there, what is bipolar disorder and how can it be treated?
Yes, I think that came in the news for some reasons. I think
because of the film actor.
So I will just say that as the term briefly describe it, as a term said, bipolar, two poles. So there are. We have talked about depression here. Because it is like a wave. You have a wave which goes down and the wave which goes up. So down phase becomes a depression, whereas up phase becomes a mania phase or hypomania or excitement phase. So any person who is instead of feeling low, feels happy, excited, irritable, more energy, and like in depression we have lack of energy, but here we have more energy, more demanding, more irritable, want to meet many people around, so very demanding. And so that is what is bipolar. So in bipolar, even if you have a phase of mania, high phase, or we call excited phase, then also we can label as a bipolar disorder. So but the important thing here is that in bipolar you have these phase of excitement, which is there, where opposite of depression, what is there.
Right.
It's treated by, and again there is a very important, very very effective treatment for bipolar disorder, and there are treatment available. There is effective treatment. Only thing, you have to be in touch with your doctor, psychiatrist on regular basis, and there is a very effective available treatment.
Yes, just because of lack of time, just I'll take 2-3 more questions only, because the number of questions are still there. Sir, you spoke of some self-evaluation scales that are there. Which are those scales and which among them is most reliable, specifically for research purpose?
Okay, that's a good point. Actually, Dr. Chandni is also here. In one of our study, we used something known as PHQ-9. That is a primary health questionnaire. There are only 9 questions are there. You just have to rate, in that. And out of this, you can self-evaluate. But my only caution here is that, usually it is seen that whenever we apply a questionnaire on self, you tend to overrate yourself. But the gold standard is always talking to your doctor, and but yes, to screen yourself, you can use it, but don't panic so much, don't worry so much that your scores are high and what will happen and so on. So always consult your doctor in that scenario.
Sir, what is OCD? We often hear about it. So is it linked
OCD, as the term says, obsessive compulsive disorder. Obsession is, you have repeated recurrent thoughts like your hands are dirty, I need to wash them repeatedly, so this is a common complaint. And you have thoughts about, something goes repeatedly in your mind, that I have not checked my door, should I check it again and again. So but some of these symptoms are there to all of us, but when they are very severe, and then it becomes a disorder. And again, there is effective treatment for that also.
Sir, any specific reason why it is more common among women? I mean, apart from their role in the society, or it's hormones also that play role?
I think you have answered your point, because hormone and
Okay.
also women, especially in the context of, antepartum, postpartum, and
Right.
so on, so again,
It's just last one, I think I'll take them many more. If depression is so easy to diagnose, why is it missed by family? I mean, what can we do for preventive? You have given many strategies, but also people don't talk about it openly, or they hide it. Even if they get cured, they won't come and share, or so can it be prevented? Can we have some support groups or some kind of awareness, more awareness? Can it be built among people so that we have, like, this can be, because you said it's going to be in the next few years, it is still going to rise, and after this COVID pandemic, it's going to be all these mental disorders pandemic and all that. So what should we do to for the entire society, so that there's
I
more
think
awareness?
that's a very important point, and I did touch about that. I think the major obstacle and block is the stigma and discrimination. I think
Correct, correct.
because, but also let me tell you that when we consider all psychiatric disorder, depression has actually less of stigma, because even you have other illness, you just say depression, because depression is the
Right.
word now commonly used. Even for other condition, you use the term
Yeah.
depression. So one is that depression, because of the stigma, there is a problem in seeking help. Because family will say, no, tumhe to pagal karar diya hai, you are labeled as a psychiatric patient, and so that's a reason that no one want to seek a help, because the label is given of psychiatric illness, and that's a major obstacle in that way. So the best is to create awareness, to have such type of discussions, and the family. Also, I would say that family does play an important role, because a person may not want at time, but family can take to a doctor, because if they think that this is a medical illness. Because I will tell you, the major problem comes that even the family member in many instances, they think it's not a real illness, like something where you have a fever, where you have blood pressure high, where you have pain and all. You think it's a real illness, whereas the depression, it is being, as I was discussing in my presentation also, that they consider that no, we'll take you some other place, we will do this. It is not considered as a real illness. So I think that's a major stumbling block. When the things become very severe, then they realize, okay, but by the time at time it becomes too late.
Right.
So my message here is that whenever these are, you consider it's like any medical illness, of course you need to seek a help. And first, the family is important help, then professional help is needed. And as I am saying, it's a highly treatable. You just have to come to a doctor, then good medicines are given, and you will become fine, and you will like a normal person. So you remove that obstacle, because that is in your mind, and the family plays a major role.
Sir, just last question. Sometimes it is said that person has everything: money, fame, education, family, everything is there. If you look at the person, everything is there. And yet person is depressed. And is it that the depression is seen only among the upper class or middle class, and not among lower class people?
Again, in fact, I do not have a slide of myths and misconception, and that is also one of the things. And always I tell my, people that, like when parents bring their child to us in a clinic, they say, no, he is going to the best of the school. We are taking him outside the country for vacation, holidays. He is the best of house. He has, everything. Then why is he depressed? As if depression is related to deprivation, not so. Depression, again, I am saying, it's like a medical condition. It's a neurochemical imbalances which happens, and which can happen to anyone. It can happen to a poor person. It can happen to a affluent person also. So if it is so, then it has to be treated like a medical illness. So it's a, of course, there are, as I said, because life events does play a role. Deprivation, poverty also plays a role. So I would not say that it is only in upper class, not in low. It can be there also, and we have seen many patients of. But again, the priorities are different for them. The priorities, food and all. So I think one, it's a major misconception that only it affects a certain group of people only. Depression is one condition which can affect anyone across the state of the society, anyone across the age, like children, adolescents, old age, adults, and anywhere in the world also. There is no place in the world which is immune to it. So it's a total misconception. So but of course one has to see and talk to a person what the issues are. Based on that, the other therapies are done.
Thank you so much, sir. It was a brilliant session, and you have answered also all questions. There are still many more, and I'm sure people have many things have been clarified about especially the misconceptions related to depression. So, on behalf of Nutrition Society of Mumbai chapter, I again would like to thank you for sparing your valuable time, and I'm sure we will call you again. We would like to have much more information, because you are also an ocean of this knowledge in this area. So, thank you once again, and wishing everyone happy Dasera. And as sir has said, it's a good over evil. So whatever, even mental disorders, whatever we have right time, we should treat and come back to normal very soon. So thank you very much. Now for the next session, I would like to request Mrs. Chandini, who herself is our PhD scholar and who's doing a lot of work in this area, to take over for the next session. Thank you so much.
Thank you so much, Dr. Veena Yadi and Dr. Sagar. It was an excellent session and excellently moderated as well. So without further ado, I would like to introduce the next speaker with all of you. Just allow me a minute to share my screen. So very eagerly, I'm sure a lot of you are looking forward to hearing the next speaker's talk, which is on nutrition. We have our next speaker, Dr. Tatiana Rocks. Dr. Tatiana is a postdoctoral research fellow and head of translational and educational stream at the Food and Mood Center, Impact, Deakin University, Australia. She is a PhD from University of the Sunshine Coast. Dr. Rocks is extensively involved in education and training of professionals and community in nutritional psychiatry, and is regularly invited to speak at various academic and professional events. She's an accredited practicing dietitian. Dr. Rocks leads several research projects exploring the relationship between diet and mental and gut health, including investigations in individuals with eating and post-traumatic stress disorder. Currently, Dr. Rocks is leading a free online food and mood course through Future Learning, which has more than 55,000 enrollees globally. The topic that Dr. Tatiana will be speaking on is dietary strategies in the prevention and management of depression. Dr. Tatiana Rocks, I would request you to take over the session now.
Thank you very much for this wonderful introduction, Chandni. I would like to thank the Society, Nutrition Society of India, Mumbai chapter, and particularly Dr. Subhadra Mandalika for inviting me to present today. It's my absolute honor to share my knowledge with you. I also would like to thank Dr. Rajesh Sagar for such a wonderful presentation. I think you all agree with me that we all learn a lot. And he highlighted very well what an important topic mental health is. So I will be talking to you today about the importance of diet for mental health. So I'll talk about diet in prevention and treatment of depression. So as Chandni mentioned, I work as a postdoctoral research fellow and head translation and education and food and mood center. It's part of medical school, Impact Institute of Deakin University. So I'm gonna talk about, after brief introduction, I'll talk about nutritional psychiatry. I'll discuss what is it and why is it important. I'll outline some of the evidence on diet and mental health. I'll talk about biological mechanisms which link in diet and mental health. So Dr. Sagar talked to us about this high comorbid presentation of depression with, say, metabolic disorders. And I'll talk about these biological mechanisms and focus on gut-brain axis. I'll talk about therapeutic potential for treatment of depression and discuss some dietary approaches we all can use to support treatment of depression. And I'll also talk about some practical steps and some consideration we need to be mindful of. So I come to you today from Australia. I'm originally from Eastern Europe, from Ukraine, but for over the last 2 decades, I've been calling Australia home. Sorry, I just want to make sure that I'm sharing my screen with you. Can everyone see my screen?
Yes, Dr. Rox, it's visible.
Okay, you can see my slides?
Yes.
Excellent. So, as I mentioned, I'm originally from Eastern Europe, Ukraine, but today I'm talking from Geelong. So Geelong is in state of Victoria in Australia, of course. So, and I work at the Food and Mood Center. In the Food and Mood Center, we're pioneering research in nutritional psychiatry. So nutritional psychiatry, it's that part of research and practice which links diet and mental health. And we look at on these links and explore how we can treat mental health all through different stages of life, starting from earlier life, from even before a person is born in pregnancy. Then infancy, we discuss importance of diet at this stage, to all the way to healthy aging, where we consider what impact diet might have on cognitive decline and neurodegenerative disorders such as, for example, Alzheimer's. Although we focus mainly on mental and brain health and explore conditions such as depression, anxiety, eating disorders, or PTSD, we also take in mind, we also consider health behavior and determinants such as, stress or physical activity, and we see how mental health closely linked to physical health, such as gut health or cardio health, metabolic and vascular health. We also focus on translation and education and lead few world-first activities in education and nutritional psychiatry. So why nutritional psychiatry? What is it? Well, psychiatry is very important. And nutritional medicine should be considered in psychiatry because despite our efforts, and Dr. Sagar covered a lot of them, despite our efforts in treatment of mental disorder, today we only achieved very modest benefits in addressing that large burden mental health issues present to individuals, to society, to countries, to economies. Also, because mental health quite often comorbid with poor physical health. So because of that, we advocate for nutritional psychiatry as a central in determining treatment for mental health issues. Again, we already discussed, we already heard from previous speakers that mental health disorders have very complex determinants. There's genetic factors and biological factors, environmental and social factors, developmental factors, and many of these we cannot change, or they might take significant amount of time and resources to change. What's important about lifestyle factors, such as diet and exercise, smoking, or substance misuse, these ones are modifiable. We can, with a bit of effort, change diet or increase our exercise or address substance misuse. And this is why diet is such an important factor in this mix of mental health. So, and Dr. Sagar covered some of the extensive burden mental health issues have right now in the world. He focused on India. I'll just in next couple slides cover a little bit of global situation. So currently, according to the latest global burden of disease risk factors assessment, dietary factors or dietary risks, when you can see, have a substantial impact on global health risks all around the world. So for example, in females, poor diet is a second contributing factor to premature mortality, whereas in males, dietary risks are third factor attributing to premature mortality. When we look overall at global mental health issues and substance abuse disorders are the leading cause of disability right now. So quota of all world disability is attributed to poor mental health and substance abuse disorders. And as you can see, out of all these disorders, depressive disorders or depression take a very big chunk, very big percentage. That's why depression is a focus of today's presentation. So let's have a look how diet and depression are actually linked. So we understand that poor diet is one of the leading causes for premature mortality worldwide, whereas mental health issues is a leading cause of disability worldwide. So let's have a look how these two are linked. And I want you to think about diet. When I say about diet, I'm talking about overall dietary intake. So I know for quite a decades, we understood that what we eat is actually linked to our physical health. But now we developed the understanding that what we eat also impacts our mental health. For example, this study was one of the first studies in the world that established this relationship between habitual diet and mental health disorders. This study was conducted by the director of my research center, Professor Felice Jacka, and it's looked at habitual dietary intake of just over 1,000 women, aged 20 to 93. And what this study showed that irrespective of other health behaviors, their dietary intake was closely linked to their mental health outcomes. After this study, there was a lot of other research conducted all around the world. And it assessed different dietary styles because all around the world, people, of course, eat different foods and consume different cuisines. But what it's established that despite different countries, cultures, or different food consumes, there's a consistent pattern when we understand that traditional whole food diets, such as Mediterranean, for example, it's only example, it doesn't have to be Mediterranean. It's more about this traditional whole food diets. So traditional whole food diets, which are based on high intake of plant food, vegetables, fruits, legumes, grains, nuts, with moderate intake of fish, dairy, lean meats, and good oils. So diet which are based on whole food demonstrate protective qualities when it's come to our mental health, including depression. On another hand, we can see that Western style diets which are based on highly processed foods, which are high in added sugar, salt, fat, and very low on fiber and other nutrients, showed to be absolutely detrimental for our mental health. So again, we can look at different cuisines. They don't have to be Mediterranean, or they don't have to be people consuming food in Australia or anywhere else specifically. It's that style, dietary style, Western style diets, which are based on processed foods, associated with lower mental health outcomes. And it all starts, as I mentioned, before we're even born. For example, this study was conducted in a very large cohort of Scandinavian mothers, where researchers follow up mothers from a second trimester of pregnancy until their offspring, their kids, were age of 5. And what this cohort studies showed, that impact of this earlier life nutritional exposure really extends from physical to mental health. Because as I mentioned before, we understood that of course what mother consumed during pregnancy will have impact on physical health of children. But here it was one of the first studies linking mother's diet with mental health outcomes of kids as well. This specific study showed that higher intakes of unhealthy foods, so foods which are very high in added sugar, salt, fats, highly processed foods, were associated, when it happened during pregnancy, were associated with antenatal depressive and anxiety symptoms in mothers. And Dr. Sagar covered how important this postnatal period is for mothers and for children's health. So this study showed that higher intakes of unhealthy food were associated with antenatal depressive and anxiety symptoms in mothers. Also, intake diet by mothers during pregnancy was related to increased externalizing behavior in children. Externalizing behavior, it's that type of behavior when kids show anger issues or bullying issues, and that's how we kind of measure mental health in kids. So poor diet, higher externalizing behavior in children. And in kids, it was related to both internalizing and externalizing behaviors. And what's important that this study showed independent relationship between lower intake of healthy food and unfavorable outcomes for mental health. Next study was conducted in slightly older children, so age 11 to 18. And we know that almost half of all mental health issues present during this age. So it's very important age for prevention and treatment. And this study was showed that both important, the highest intake of unhealthy food and highest intake of healthy food. They were both very important. So it showed that it's not enough just to consume, unhealthy food. We also need to consume enough of healthy food. As I mentioned, plant food, whole food, vegetables, fruit, grains. Another study, it's a big systematic review which pulled data from all around the world. And what it showed, again, something which I mentioned before, that no matter how you identify healthy diet, but diets with those common denominators, such as high intake of plant foods, vegetables, fruit, whole grains, legumes, and low intake of highly processed foods, where they either Mediterranean diet or diet with lower dietary inflammatory index. They both show to be protective of developing depression. So they were associated with decreased incidence of depression. So diets with the common denominators of high intake of whole foods. When we look at diets and when we look at biological dysregulation, which associated with depression, such as inflammatory and oxidative stress. We're not going to cover this today, but we know that in depression and other mental health issues, patients present with higher markers of inflammatory and oxidative stress, metabolic issues, and we covered them as well. So high comorbidity of insulin resistance, metabolic syndrome, so higher body weight, higher blood pressure as well, dysregularities in HPA axis, and also the importance of neurotransmitters such as neuropeptides, dopamine, serotonin. When you look at all these factors, each of them is actually modified by our gut microbiota. So right now I'll cover a little bit of this topic. So when we think about gut microbiota, it's important to understand the complexity of it. So here I usually like to say that if you ever feel alone, don't feel alone, because you literally, all of us have 100 trillion of microorganisms which live inside of us and on us. In fact, most of our genetic material, so 99.5% of our genetic material, is actually belong to gut microbiota. We have only 23,000 of human genes compared to almost 4.5 million of microbial genes. So we have microorganisms living, of course, all around us, but the majority, the biggest hub of gut, of microbiota, is our gut. So the variety of different microbes increase as we descend with our gastrointestinal tract. So the lower you get from your mouth right to your anus, the more we get variety of different gut microbiota. And gut microbiota being very interesting area of science. It's exploding area of science. There's a lot of research happening in this area. And most studies reveal some kind of association between gut microbiota and different human states of health or disease. It's important to understand what are actual implications of these associations, because gut microbiota function, we know that it's influence a lot of bodily function in human beings. It's associated with immune maturation, with our bone density, energy production, pathogen, protecting body against pathogens. It also participates in biosynthesis of vitamins and hormones. It, of course, plays a very important role in metabolism. It's also might impact the way we consume, or the way we actually take certain drugs or dietary components. And in different disease states, it's been linked to all variety of illnesses, including neurologic, psychiatric, oncologic, metabolic, gastrointestinal, of course. And very importantly for our topic today, it's also been linked to our mental health. So the link between gut and brain, when we talk about the link between our gut and our brain, we talk about so-called gut-brain axis. It's that bidirectional communication between microbiota in our gut and emotional and cognitive centers of our brain. And what we understand here clearly, that quality of diet have impact on this communication. Overall, of course, gut-brain axis, that bidirectional communication, use quite several pathways, including neural and endocrine, metabolic and immune pathways, because we understand that our central nervous system, of course, affects gastrointestinal tract and our other gut nervous system. It impacts HPA axis and production of cortisol, which is very important for numerous bodily functions. It's also gut microbiota also responsible for production of metabolites. So production and secretion of neurotransmitters and neuropeptides, and they communicate with our different centers in our brain. Of course, gut microbiota have very important impact on our immune system and how our body deals with inflammation. And gut microbiota, of course, is a producer of short-chain fatty acids. So short-chain fatty acids, those very important components which have high impact on local gut health, but also resonate to overall health. So what's important to understand that in gut-brain axis, the majority of evidence come from evidence in animal studies. Although it's very interesting area of research and practice, we simply don't have enough research in humans to make a definite decisions. What we see in animals, that, for example, mice which been bred in sterile environments, so without any microbes, show different responses to stress. So they have exaggerated HPA response to stress. They also have altered level of BDNF, brain-derived neurotrophic factor. Those mice also have blunted immune response, different metabolism of tryptophan, increased permeability of blood-brain barrier, that very important barrier which protects our brain. They also have abnormal development of brain centers. And what's important, we see that another side of gut-brain axis where animals with altered gut microbiota show models of depression and earlier life stress as well. And what's interesting in animals, swapping intestinal microbiota can actually switch behavioral phenotypes. And that shows us clearly that there is that communication between gut and brain. So in mental health specifically, gut microbiota been studied in relation to depression and anxiety, so our common mental health issues. But it's also understand that gut microbiota is tightly linked with just the normal states of body, and stress sometimes is a normal state of body. You don't have to have a depression to be stressed. We all know that regardless how we feel, what kind of mental illnesses we have, we might experience stress. And we can see that our gut microbiota reacts very quickly to stress. We all know, perhaps, or most of you would understand what I'm talking about when we're nervous. We have some kind of gut feelings. Here in Australia, we say butterflies in the stomach. That's not really butterflies, that's actually our gut microbiota experiencing changes because of our stress. But also gut microbiota been showing to play a role in other mental health and other neurodevelopmental disorders such as autism and neurodegenerative disorders such as Parkinson or Alzheimer's disorder. We don't quite understand what's more important, what drives what factor. Either gut microbiota drives mental health or mental health impact gut microbiota. What we do understand that proportion of psychological conditions in people with gastrointestinal issues is much higher than in people who don't have any conditions. For example, in people with irritable bowel syndrome or ulcerative colitis, we see much greater presentation of depression and anxiety. And we simply don't know enough to ascertain why is it happening. Is that because of pain and suffering associated with gut conditions lead to depression and anxiety? Or is it depression and anxiety driving our gut conditions? There's not enough studies of gut microbiota in people with major depressive disorder. This is one of the first population-based study with over 1,000 people participating there. And it showed that generally those butyrate producing or prevalence of microorganisms which produce butyrides, it's a type of short-chain fatty acids, is actually associated with higher quality of life. Whereas in individuals with depression, we see specific gut microbiota such as Dialista or Carpococcus is actually depleted. In general, when we talk about gut microbiota, the more variety you have, the better it is. But we still don't know enough on the topic to make definite conclusions. We also understand that there's a variety of different factors which might influence our gut microbiota. So starting from birth mode and geography, how we were fed as youngsters, where we had any pets growing up, what kind of food we consume, how it was produced, where exactly we live in the world, our age, our state of disease, all of it will impact our gut microbiota. But by far, the biggest impact and most fast impact on our gut microbiota composition we see coming from diet, which kind of makes sense because it's right there. So, and what we see here, it's a very similar situation in gut and diet as in mental health and diet. It's again simply prudent diet or traditional diets which are based on high consumption of plant foods and whole foods such as grains, legumes, fruit, vegetables, seeds, nuts, with a moderate intake of high quality proteins, so not highly processed proteins such as fish and seafood, dairy, eggs, is actually have very good impact on our gut microbiota because these diets are very high in phytochemicals such as polyphenols, which we discuss a little bit later. They're high in omega-3 fatty acids, and they also high in dietary fiber. So dietary fiber, of course, is very important for our gut microbiota because it delivers the main energy source for them. And in consuming dietary fiber, which we as humans cannot absorb because it moves down in our colon, and in colon it's being consumed by gut microbiota. So in consuming gut microbiota, in consuming fiber, gut microbiota produces a lot of short-chain fatty acids, as I mentioned, which really have fantastic healing and protective effect on our gut lining. It enhances mucus secretion, it increases antimicrobial peptides, and it produces that beautiful layer, lovely layer, which protects our gut lumen. It's also shown to regulate immune responses. For example, it decreases oxygen, that gut level or lumen level oxygens. It also upregulates or makes sure that tight junctions in our gut is actually functioning properly. And it's have overall fantastic effect on our health. On another hand, when we consume Western diet or highly processed diet, which usually does not have enough fiber, so it's usually high in sugar, it's usually high in added fats and all other food components or promoters of highly processed food productions, for example, such as in emulsifiers and other additives. So these diets are usually associated with quite a detrimental impact on our gut microbiota because it enhances that mucus degradation. So instead that nice buffer, this nice protective cover we have in gut of people who consume high plant diet and highly unprocessed diet, in people who consume a lot of Western type of food, we see that reduction, degradation in mucus. We also see reduced antimicrobial peptides. So body develops decreased ability to actually fight any microbes which come in our way. It also impacts our gut to upregulate pro-inflammatory immune responses. So we have this increase of oxygen, we have that increase of inflammation locally in our gut, which also resonate to our overall health. We see that diet which are very low in fiber also have impact on our tight junctions. It's down-regulate tight junctions and might lead to gastrointestinal permeability when we see that basically components which should not be leaking out of gut actually do because of low consumption of fiber we see in Western diet. So generally, as I mentioned a few times, the main rule, what is good gut diet, is diet which is based on whole foods. So the less processed it is, the better. So diet which have high intake of plant foods, vegetables, legumes, fruits, whole grains, nuts, and seeds. Diet which also have some fermented foods, so yogurts or miso or kombucha or any fermented vegetables, and diet which also includes some good fats, which we see coming from olive oil or nuts or omega-3 fatty acids. So let's have a look. That was my explanation of gut and mental health and that gut-brain axis. Unfortunately, I don't have time today to go into much more details today because I want to talk now about treatment for depression, treatment which is focused on diet. So what we understand now, that treatment of depression, even if it's pharmacological treatment of depression, it could be very successfully supported by changes in diet, by positive changes in diet. A few years ago, our center led worldwide first randomized controlled trial, which we call the SMILES trial, which actually explored just that. It's looked at including diet or using diet as a main treatment for adults with major depression. So they were people, the adults in this study, were people who were clinically diagnosed with major depression. So they were not just having low moods, they actually had clinical depression. So we enrolled 67 adults and we investigated how 12 weeks intervention, which focused on diet, might impact their depressive symptoms. Because it was a randomized controlled trial, we included equal amount of participants in dietary support group, and another group went through social support or befriending protocol of similar intensity, because we wanted to compare diet and social support. So diet in this study, called MODIMED diet, was based on modified Mediterranean diet. So it was kind of this synergetic combination of traditional Mediterranean diet and current recommendations in Australia for healthy eating. The diet was designed and delivered by dietitian. So each participant in dietary arm went through 7 individual sessions with dietitian. And each session was focused on different goal settings. So it's focused on changing dietary behavior. So every time participants met with dietitian, they had to make few goals how they can improve their diet. Here is the pyramid which we included in MODIMED diet. That's a pyramid which guided the principle of MODIMED diet. So over here, let's have a closer look. What was the main principles, or what were the main principles of MODIMED diet? So this diet was very rich in vegetables, fruit, and whole grains. So for example, for whole grains, we recommend that from 5 to 8 serves every day to consume. For fruit and vegetables, we recommend that up to 6 serves of vegetables and 3 serves of fruit every day. When it came to dairy, we understand that dairy, such as milk or cheese or yogurt, is very important, of course. It's very valuable nutritional food. It's also very high in calcium. So recommendation for dairy was about 2 to 3 serves each day. And remember, because dietitians sit down with each participant, they were able to adjust these recommendations for specific needs of participants. Also, ModiMed diet were very high on intake of olive oil. So olive oil, we know, being investigated for its beneficial impact on health. So in ModiMed diet, sorry, my screen is keep changing. Sorry about that. So in ModiMed diet, we recommended for the main fat, for the main added fat coming in the diet was olive oil. So extra virgin olive oil, as many as 60 milliliters every day. We also recommended participants to consume nuts every day, 30 grams of unprocessed, so raw nuts without sugar or salt or anything else added. We also discussed the importance of consuming legumes and recommended regular consumption of legumes, about 3 to 4 serves every week. We also discuss consumption of lean red meat. And generally, Mediterranean diet usually is very low on red meat. But in Australia, we know that red meat is a very important source of iron. So that's why we recommended moderate amount of lean red meat, 3 to 4 serves each week. And serve is usually about 70 grams, so smaller serve of lean red meat. We also suggested participants increase intake of oily fish, so seafood, but particularly oily fish, to about 2 serves every day. Poultry, 2 serves every week. Poultry, about 2 serves every week. And eggs, of course, was important as well. And generally, we recommended about 6 eggs every week. What was important that we limit intake of alcohol, or suggested to limit intake of alcohol to no more than 2 standard drinks per day. And we also asked participants to limit their intake of extras, what we call, so sweets and highly processed foods such as chips or sugary beverages and stuff like that. So that was very important component. So we asked participants not to consume more than, say, 3 serves of it weekly, not daily, but weekly. So to support these changes, to support understanding of the diet and uptake of the diet, we provided, or dietitians who led the study, provided a lot of information for participants and a lot of educational material. So this is one of the examples. And these foods, of course, it's Australian study. So based on Australian foods, foods here are usually freely available in supermarkets, and they're also affordable, so they don't cost too much. So very simple foods such as tinned fish or eggs, or already pre-prepared, say, chicken. We suggested them to be mixed with grains, so something like rice or wholemeal toast or couscous or whole grain biscuits, and add a lot of vegetables. They don't have to be, you know, fresh vegetables. It could be canned vegetables or frozen vegetables. So any vegetable is a good vegetable. That's basically our rule. And providing educational material like this really supported these behavioral changes, because quite often people don't know what to eat. There's a lot of misinformation, what's good, what's bad for you. So having these resources, providing them for participants, ensured that they actually knew what to do. And look what happened. After just 12 weeks, we saw the significant decrease of depressive symptoms in dietary support group. So much so that 1/3 of dietary support group actually achieved remission criteria for depression. And it's very important outcome. It just took 12 weeks of adjunct treatment with diet for people to go into remission. We also conducted economic evaluation because Dr. Sagar covered what a significant costs depression is for society, for individuals. Here we actually calculated the cost of diet, the cost of dietary intake for participants before intervention, which was about $138 every week. So it's in Australia, in metropolitan area, in Melbourne and Geelong. Before study, participants spent about $138 for their weekly shopping for one person. And the Modimed diet was being calculated to cost about $112. So individual savings of about $26. We also calculated how much cheaper it was for healthcare sector and societal cost in comparison to social support group. So in comparison, dietary support group, dietary treatment was about almost 3,500 Australian dollars cheaper than social support conditions. So when we think about it's for each individual. So dietary treatment is highly cost effective for individual and for society. And since our intervention, there were a couple more interventions that use the same treatment or same type of treatment, modified Mediterranean style diet for depression. In this, in Healthy Med, our colleagues from South Australia used grouped approach. So if SMILES trial used individual approach, here treatment, 3 months intervention was presented to a group of individuals with depression. And this intervention ran cooking groups. It's provided participants with hampers with different examples of food and with fish oil supplementation. And it's compared this dietary intervention, which built on all knowledge and skills, because it's were cooking workshops, there was a lot of skill building on how to prepare healthy food. It's compared this intervention with social support group. And what it showed again, that just after 3 months of treatment, the dietary support group showed significantly more reduction in depression scores compared to social support group. And similar intervention was run in younger adults. That group conducted research in students, in Australian students, and it's enrolled younger participants, so age 13 to 35, with moderate or higher depression symptoms and poor diet. And it's compared dietary treatment with control, which was just diet as usual. So this intervention was also developed and delivered by a dietitian, and it was actually very light on production because it was based on Australian guidelines, Mediterranean style of eating, and it's only included a 13 minutes video for participants where a dietitian actually explained to them what links diet have to mental health and what dietary changes participants can make to support their mental health. Dietitian also gave phone conversation or called participants on day 7 and at the completion of the diet on day 14. So that diet only ran for 3 weeks. So, and again, similar to Healthy Med diet and to SMILES trial, this study showed that dietary group had significantly lower depression symptoms than control group after completion of the intervention. We also now have meta-analytical level of data which showing that dietary intervention significantly reduce depressive symptoms. We have a mixed finding for anxiety, and we understand that when it's come to dietary treatment, we see greater benefits in females than in males. We also understand that dietary interventions which are delivered by nutrition professionals, so dietitians or accredited nutritionists, they have more impact. That's important. And also dietary interventions which not focus on weight of participants, not on body weight, but on depressive symptoms, usually show more impact on depressive symptoms. In preparation of my talk, I've been asked questions about treatment with supplements. So interventions I just discussed were based on food, but this one is a very good guidelines of very good guide if you would like to know a little bit more on treatment of depression with supplements. So Canadian Network for Mood and Anxiety Treatment have clinical guidelines for management of adults with major depressive disorder. And in this document, which is available online in section 5, it actually underlines the complementary and alternative medicine treatments for depression. In particular, the document is extensive and it explains how the evidence were actually ascertained, how they were grouped, and what studies were considered, and it shows the level of indication. So either depression is mild or moderate, and shows what kind of recommendation it is. First line, second line of treatment, and is it good for monotherapy or adjunctive treatment. So I'm not going to have time to go into it, but I just want to let you know that if you'd like to know more, this document will show you specific supplements, the dose, how to prescribe them, and how they should be used. It's talk about different ones from, say, omega-3 fatty acids or St. John's wort, which are which have evidence for treatment, either as monotherapy or adjunctive treatment for depression, to other supplements which either less investigated or showed no results in or no benefits in treatment of mental health issues. So I just thought I'd quickly cover this because people were asking questions about supplements. I also been asked question about polyphenols. So polyphenols are, of course, chemical compounds which are highly prevalent in plant foods. So plants use polyphenols for their own needs. They usually high antioxidants, and they show to be highly beneficial for human health. There's a lot of interest and a lot of research now happening in effects of polyphenols, for example, on gut health, which showing very good benefits. This specific, very recent systematic review actually looked on effects of polyphenols from different foods, such as tea, coffee, citrus, legumes, spices, specifically on symptoms of depression. And this type of polyphenols, which are very high in Mediterranean diet, because foods as nuts, citrus, grapes, legumes are, of course, highly consumed in Mediterranean style diet. And this specific review showed that there are actually beneficial outcomes in prevention and treatment of depressive outcomes from polyphenols. So this study is also freely available online. So if you'd like any further information, please refer to this study. I also been asked about comfort eating and what kind of impact comfort eating have on our mood and on depressive symptoms. So comfort eating in science literature is that consuming highly palatable or tasty food in effort to decrease negative emotions. And of course, comfort eating might have very different meaning for different people. For some, comfort eating is associated with specific food they may be consumed as children, or some foods which they usually consume when they're sick. They might have special tea or like to bake some cakes or special goods. So from psychological kind of aspects, comfort eating does make sense. However, I just want to show you a couple studies which actually show that it doesn't matter what you eat or don't eat. This specific research showed that there's very little evidence in support that specific foods might be comforting on our psychological outcomes. In this study, which was done in 150 healthy women, 2 types of comfort food were investigated: unhealthy or healthy. So before these women were subjected to specific trigger, they were asked to do public speaking. Before all this, they were asked to identify their comfort food of choice, either healthy or unhealthy. And these women were actually offered these foods which they were identified as comforting foods for them at 2 time points. So during stress anticipation and after the stressor. And the 3rd control group had no food, unfortunately, not healthy or unhealthy. So there were diverse outcomes. So what this study basically showed that either type of food, either healthy, such as snacks like fruits or vegetables or bananas, apples, or unhealthy, such as donuts or sweets, actually did not influence either reactivity or recovery from stress. So absolutely, there was no difference between also type of food and outcomes. So what basically this study shows that in this specific instance, there was absolutely no evidence to say that some food provides some comfort for stress, or there is a specific type of food which might be comforting. So if you like, or if your patient's asking you about comfort food, you can tell them that they can eat carrot or sweets. It will have no impact on their stress level. Another study actually looked at specifically sweet foods, because in many cultures, sweet foods are used as a comfort food. And in this specific systematic review, which combined the outcomes of 31 studies, which with almost 1,300 participants, this specific review showed that there's absolutely no positive effect on food high in carbohydrates on any aspect of mood and any time point. Interestingly, that on the contrary, higher levels of fatigue and less this alertness was reported in people within the first hour post ingestion of highly sweet food. So this particular study is showing that there's again no link between sweet comfort food and any aspects of mood at any time point. All right, so let's have spent last few minutes, and I know that I don't have much more time, but I just want to cover a couple issues in implementation of dietary treatment. We know that when we talk about dietary treatment overall and specific in depression, there's a lot of barriers, such as behavioral, motivational, social, and financial challenges. And it's very important for us as practitioners to address the depression through diet and through other means. It's to address those barriers. We also know that in mental health, and particularly in depression, Dr. Sagar mentioned a lot of low motivation and fatigue, and it's quite common in depression. We also might see some medical side effects and interaction. Not always negative, not always, but they sometimes there. Comorbid physical conditions, we discussed this. So poor physical health might play the role as well. Of course, there are addiction and substance use, and sometimes disordered eating patterns. So all of these have to be addressed for successful implementation of dietary change. And for this, we as practitioners really need to understand psychoeducation and counseling skills for behavior change techniques. So, and Dr. Sagar mentioned that different types of psychoeducation are used by psychiatrists and psychologists, but if you are a practitioner, who dealing with food, such as nutritionist or dietitian, you also need to understand that, because you need to understand how to increase motivation and this capacity for change in your patients and this capacity for self-management. So you help them to develop these skills for rest of their life. You need to understand how to conduct nutritional counseling. There might be some stigma in mental health issues, so you got to be very empathetic and non-judgmental, and you need to be quite attuned in with psychosocial and cultural issues which your patients might have. And of course, it's very important to have that collaborative multidisciplinary approach. In our center, we lead recommendations for overall lifestyle treatment of mental health disorders, where we talk about clinicians and health practitioners from very different areas of practice, psychiatrists and GPs and counselors and dietitians. They all need to work together for successful implementation. To overcome the challenges, it's very important to understand how to actually deal with mental health issues and how to deal with people with mental health issues. Quite often, you need to use multimodal techniques. You need to try different styles and different approaches. You need to review information. It's okay to repeat information, because sometimes it's hard to take it in. We all know when we stress, even if we have perfect mental health, when we stress, it's sometimes hard to take information in. Imagine how difficult it's for someone with depression. We need to educate people. People need to understand why nutrition is important, particularly adults. They need to understand why it is important to implement some dietary changes. We also need to understand at what state of motivational state our patients might be, and use specific techniques depending on their different state of motivation. We need to understand that their lifestyle might be very different to ours, and they might have a specific nutritional needs because of their lifestyle or because of their other physical conditions. So, and we need to develop a lot of skills, a lot of capacity building, a lot of skills, social skills, knowledge, skills around food, mindful eating strategies, and a lot of other attributing factors which will impact this change in behavior. Remember one thing, that we need to have realistic expectation. Remember, we talk about complexity of mental health. So diet is just one factor, modifiable, but only one factor. And I like to also finish with positive focus, because we know that optimism, it's our ability to adjust and solve problems and have this constructive focus, is being shown to have positive impact on our mental and our physical health. Whereas pessimism, where it's coming from patient or where it's coming from us as practitioners, will decrease potential for improving dietary behavior. We need to include positive thinking in ourselves as practitioners to radiate then this positive thinking for our patients. Because, for example, World Health Organization defines that for individual experiencing mental illness, recovery is foremost of that feeling of hope, healing, empowerment, and connection. And I really encourage you to remember that as you move on and try to implement dietary changes in treatment of depression. So in summary, I hope that my talk showed you that diet has profound links with mental and cognitive health across different life ages. Diet is modifiable, and that's why it should be addressed as preventative and therapeutic measure in treatment. Optimal diet for mental health and for depression is based on whole foods. No matter which part of the world you live, but diets which are high in vegetables, legumes, grains, nuts, fruit, with optimal intake of seafood, oils and moderate intake of lean meats and dairy been shown to be optimal for mental health. If you like to know anything else or unpack any of the concepts I covered today further, I invite you to enroll in free online Future Learn course, which I lead there. The next enrollment in the course will start in end of November, and I invite you to participate. It's 3 weeks, it's online. You can complete that at your own pace. And as Chandni mentioned, it's got over 55 learners from all around the world. So it's a lot of social interaction. There's a lot of group learning. So it's very enjoyable. So please come and join us. Any further information, our Food and Mood Center also have a website where you can find anything else related to diet and mental health. I'd like to thank my wider team and love to hear any questions you might have. Thank you for having me.
Thank you, Dr. Rox, for that excellent and a comprehensive and, as expected, a fantastic talk. We really enjoyed. I think you're getting so many compliments from all our participants. And as a nutritionist, I have now suddenly realized I have yet another role to find out who is depressive and how can we treat them. So there are a lot of questions. There are a lot of questions. I think you have definitely dealt with each of these questions, but there are a few which I would like you to take. So are there any specific herbs or foods that could help in mood? Like they say dark chocolate, they have said some herbs. Yeah.
Yeah. So there are some foods which might have a very immediate impact on our mood. Like if we like chocolate, of course, eating chocolate might make us feel better immediately, but it might not do much for us long term. So general, we need to treat food as that healing and nourishing power. And we as nutritionists, as dietitians, we understand how important food is. So you don't have to eat chocolate. You can prepare yourself a nice cup of tea or have a piece of fruit and nourish yourself and nourish your body and your mind. And hopefully it will create a bit better mood for you.
So there is a very interesting question. There are certain foods one craves for when you feel low. And does the type of food craving indicate certain deficiency, or how to interpret those little symptoms that the body is giving? You know, like when you are pregnant, we have pica, something like that.
Yeah, that is a very interesting question. Thank you for asking this question. It is very interesting. And my simple answer is, I don't know. It is there probably a good research in it. So I encourage all young researchers to think of incorporating that as a research question. It probably is some connections, specific connections, but I don't have evidence available to draw the clear links.
So ma'am, if we want to study nutrition or eating habits and mental health during COVID-19 pandemic, which questionnaire or tool would you be recommending us to collect data from?
It very much depends what kind of data you'd like to collect and for what. If you just like to understand the impact of, say, COVID restrictions on mental health, you can just ask that on Likert scale. Was it impactful or not? If you like to see if dietary, if your participants change their diet, you might just need to ask them, because the tools, as you know, tools in this area really much based on what you're trying to investigate.
So there's one more question, ma'am, regarding tryptophan, the role of tryptophan in prevention of depression. You have definitely covered a little in your lovely research articles, but the girl wants to know what is the role of tryptophan in preventing depression and how much should we be giving?
Well, tryptophan is quite important in this regulation of our mental health, including depression. But I don't know if we can say with complete certainty that certain foods, even if they're high in tryptophan, that our body will actually accept that tryptophan through diet and then use that for our mental health needs. So it's the links, it's not quite clear how we can use tryptophan in treatment.
Which are the foods that inhibit serotonin production?
Oh, that's a tricky question too. And again, look, nutritional psychiatry really looks broader and the whole food patterns, because we understand on population level, it's much more important questions to address. Of course, this production of serotonin or tryptophan is very important, but it's so highly individual. I don't know if we have enough research in humans, not in animals, but in humans, to actually draw some evidence. Sorry if I disappoint with my answer.
I know these are a little difficult and tricky questions. Yes, there's one last question before Dr. Subhadra will take over. Sometimes individuals with depression lose appetite, and as a nutritionist, we have to encourage them to eat. Now, I know in your last slide, you have definitely said that we have a role to play, something like how today we are celebrating Durga Ma, like she has 10 different hands. The same way, I think the nutritionist needs to do that. Yeah. So what would be your take on that, ma'am? Yeah, what would be your take?
It depends. So was it in children or in adults? It depends who we're dealing with.
Anybody. I think, yes.
Yeah. Adults usually like to understand why we're asking them to do something. If we just say to them, oh, you need to eat this, they're probably not going to do it. So we need to increase their knowledge and increase their motivation. So we need to explain that not eating the food will actually make their depression even worse. So we need to explain and try to increase the motivation. It might not be easy to do, but with time, we can do it a little bit by little bit. With kids, it usually depends what their values are. Some kids, younger kids, might value some reward. So if you eat this, you can go and play with your friends, or you can watch TV, or you can do something like this. It's maybe not the best approach, but it works in kids. In slightly older kids, it's important to link dietary intake to their mental health, because all the kids already understand that eating well will make them feel better right now and in the future, and it's my help as well. But usually low appetite might signify some kind of disordered eating or even clinical eating disorder. And that's where you need to communicate with broader team to see what else is happening in patient's life.
Thank you so much, ma'am. Thank you so much. Now I would request Dr. Subhadra to take over. Yeah.
Thank you for beautiful moderation.
Thank you, ma'am. Thank you so much. We love your personality.
Yes, Dr. Rock, clearly you rocked the session today.
Oh, thank you.
It's a wonderful session, as Mrs. Shekhar already told you. And I'm particularly personally very happy the way how you have incorporated the questions that we have sent you, because this time we have collected questions that interest from the registration forms itself. And we passed on the diet related questions to you, and very beautifully within short span of time, you could incorporate all those questions and you could address with evidence-based information. That's what is most interesting. And our platform is very well known for dissemination of evidence-based information.
Yep.
So you have really done a wonderful job, Dr. Roxley. So we are very, very grateful to you. And so now to move on to my share of questions to you. So there is one question on vitamin D, because now in this current COVID situation, the depression is increasing and depression is becoming an issue of concern, and many people started noticing it and started paying attention to that as well. And so many nutrients are actually being given more and more attention, and vitamin D is one of them. whether it is for its whether it is immunosupportive role or anti-inflammatory role. But even there is evidence that vitamin D helps in mental disorders. So can you throw some light on that?
Yes, absolutely. There is a built-in evidence in linking vitamin D, or in particular lack of vitamin D body produce, to depression. For example, in countries with different climates in Northern Europe, they even condition that mood disorder. So it's a seasonal affective mood disorder. It's when we have those slow moods because there's little sun. So our body can't synthesize vitamin D from sun. So we see that, of course, those links in older people who, for example, spend, for whatever reason, more time inside than outside and don't have exposure to light. So in some situation, and medical doctor would be best to help you address this issue. We might need to measure vitamin D, what patients might have. And if levels are very low, supplementation with vitamin D might be easier fix, quick treatment to help support mental health. But it's very highly individualized, and that's when we need to understand what are the current blood parameters of the patient.
Yes. Thank you so much for that information. Yes, very true. There is difference in the synthesis, and even there are many factors that are influencing vitamin D synthesis in population across the globe. As you said, it's very important to assess the status and go by it. Since you have mentioned about supplements, and you have also given us a lot of evidence on polyphenols, omega-3 fatty acids, etc. in depression, do you think for a depressive disorder patient, in spite of his diet or her diet being sufficient, do you think they will be further benefited by the supplements from these nutrients?
It's probably a difficult question to understand, because generally what we know about polyphenols, for example, they're very hard to produce in a supplement which will deliver the same effect as polyphenols coming from whole food. So sometimes when we see patients who have perfect diet, but we don't have too many people like this, we need to remember this. But in people with perfect diet, if we see absolutely no improvement, we probably need to dig deeper. And I don't think just simply doing supplements might help. Look, it's not gonna hurt, but it's waste resources, because these quality supplements cost a lot of money.
Yes. Actually, the way how you have presented the cost effectiveness of natural diet, that itself spoke a lot about the importance to be given to the traditional dietary approach, and thereby follow dietary diversity. So you have very well emphasized that in that particular study itself, and that information, how financially it is feasible to go in for natural food sources. It's very nice. And another question is there, about the difficult groups to deal with, that is youngsters, and most importantly the adolescents. So how to make them understand or follow the dietary advice so that we can maintain a kind of mental balance among them. Can you give some suggestions related to that?
Yes, it's actually very interesting research which shows that particularly in adolescents, what approach you can take is environmental. So a lot of adolescents are very well aware of the environment issues and the poor environmental health of our whole planet. So there was very interesting study coming from America, which actually showed environmental impact of poor diet on the planet. And alternatively also showed how much is better ecologically for planetary health to actually consume diet which is rich in plants, so not highly processed diet, but plant-based diet. And adolescents, funny enough, they don't care about their health right now, because when they're younger, they think they're indestructible and nothing gonna hurt them, but they care about planet. So, and they actually, you can try this approach. Or you can try and explain to them that sometimes that, that's highly ultra processed foods which all around us, they don't do us any good. They're there to drive the profit of multi-billion-dollar highly processing food companies. So adolescents, there was another study which actually considered this ethical consideration, which explained to adolescents that, for example, we see the advertisement of highly processed food is much higher in the areas with lower socio-economic levels. So adolescents see that how those companies which produce that highly processed foods targeting specific groups of population or specific countries, and they take that as a serious ethical issues. And usually in adolescence, that's when people become aware of the ethical issue around them. And that approach also worked because eating healthier food is actually more ethical for other peoples as well. So you can try this too.
That's a very nice suggestion, actually. It's a very nice, and to understand the kind of research that is going on world over in nutritional psychiatry is amazing. It's really amazing, and we could understand all the procedures and the protocols that are required to conduct research in this particular field. In our country, it is definitely new. I'm very proud to say that I think we are the first ones to address this issue and bring out this topic on our platform. We are very happy to host this topic. Okay, and before we wind up for the session, I just have one more question that is about the socio-economic disparities that we notice mostly in developing countries, may not be so much in developed countries, wherein when we talk about the functional foods or when we talk about the fiber-rich foods like fruits, vegetables, etc., it would become little difficult for the low socio-economic groups to afford that level of dietary diversity that would help them to maintain gut microbiota or thereby the physical as well as mental health. Have you come across any such information wherein there could be some kind of dietary modulation based on socioeconomic disparities? Dr. Rox?
No, it's a very good question, and it's very, very important question, because we see that unfortunately currently dietary risks and poor dietary intake is dramatically increasing in countries with a lower socio-economic levels. And it's very important question, but I don't know clear links. In general, what I understand, in general, unprocessed foods, local foods, seasonal foods is usually cheaper than stuff we buy in supermarket, highly processed foods. At least it's in Australia this way. So you're gonna be better off, in my understanding, eating maybe low variety, but it's seasonal and local foods in the area where you live, where your parents and grandparents live, than trying to bring variety from some imported foods which might not be in season and you don't know how they produced and where they've been stored. So I think, and again, I don't know the specific research, but it makes sense to focus on locally produced seasonal foods to try to reduce the budget. That's usually what we recommend for people, say in Australia. Often we go into farmers market, into local market, and that's where we see where that cheaper food, because it's seasonal and local, is offered. So but for this, of course, you need to have a skill in preparation, and that's another story, because unfortunately a lot of us are losing this skill of preparing food.
Yes, you're very right. Even in our country, the focus on locally cultivated foods is increasing. Even our government is stressing on nutri-gardens. So, and all nutritionists are working towards promoting that culture so that people can eat whatever is locally available. Probably they may also cultivate something which is possible. So through that, it might help achieving and maintaining health from various angles. Thank you so much for re-emphasizing that. So, and just to wind up, actually the processed food whenever we say that word processed food, mostly I think you would also be concentrating on high salt, high sugar, low fiber foods.
Yes. So when I talk about processed food, I talk about this ultra processed foods, which comes in packets when you don't know what it is. It's not, you know, traditional recipes, which we still do some frying or roasting or different cooking methods, but it's more traditional. It's done to whole foods such as meat or vegetables or grains. We might even meal grains to produce the flour, but it's not that ultra processing, when all the combination of food molecules, food particles, it's changed completely, and a lot of stuff is added in, such as sugar and salt, as you mentioned, and fat, and a lot of other additives. That's what highly processed food is.
Thank you so much, Dr. Rox. It's a very, very wonderful session. I'm very happy for having thought of you as a resource person for this session. And on behalf of our chapter, we wholeheartedly thank you for making it convenient for yourself and for sharing your valuable expertise. Thank you so much, Dr. Rox. We'll be definitely getting in touch with you once again, because many participants would be interested in applying for that food and mood course, like
Yep.
which you are offering from your university. So if any details are required, we will definitely coordinate that between you and the participants, and so we'll get
Yep.
back. We'll be surely in touch with you.
Thank you so much, Dr. Subhadra, and everybody else. Just a word on the course. So the course is completely free. However, at the end of the course, if you like to have a certificate, there's payment associated with that. You don't have to pay you're not going to get any more knowledge. It's only for certificate. That's something I wanted to stress. I also wanted to thank you for inviting me. I enjoyed so much presenting to your group and interaction with your group. It was very enjoyable experience for me. I also want to wish to you and all the participants happy celebrations. Sorry, I don't have anything purple. I only have this little thing I found.
we are matching.
But I'd like to wish everyone very happy holidays and very happy, good health and good mental health. And thank you for having me. It's my absolute honor.
Thank you so much.
Thank you, ma'am. Thank you so much.
And see, we are all matching today.
Thank you so much. Thank you, Dr. Shika, for moderating. Beautiful moderation.
Thank you.
And good luck to Chandni with her PhD.
Yes. She needs it. So thank you so much, participants. Finally, I would like to thank all of you, because it's your participation and your registration that motivates us to take up more and more newer topics that are of great use for all of you. So we will continue our efforts, as I promised you in our previous webinar also, with more exciting topics in future. And I fully agree with Dr. Sagar that this is an occasion for wishing all of you on behalf of our chapter also. I've just kept it to do it at the end, but he has done it, and I'm very happy about it. So we wish all of you the divine blessings of Goddess Durga to win over the evil, to win over the negativity, and live with lots of positivity, and live with good health and prosperity and happiness. Thank you so much, and have a wonderful day. Thank you.
Thank you. Bye.
Thank you, everyone.
Bye.
Thank you.
Thank you so much, Dr. Subhadra.
I now invite Ms. Chandni to make the finishing, to give the finishing touches.
Yes, thank you so much. I'm sure all our participants thoroughly enjoyed, the talks by Dr. Rox and Dr. Sagar, and the excellent moderation by Dr. Subhadra, Dr. Shekhar, and Dr. Yadi. Before we officially close, there are a few announcements I would like to make for the participants. Just give me a minute to share my screen. So instructions regarding the certificate, the feedback form link has already been mailed to all the participants on the 24th when we sent you the links for viewing the webinar. You will be able to now fill the feedback form. We have just activated it at 1 p.m. and the link will be active till tomorrow midnight. So I request you all to fill it before midnight tomorrow. And all the participants are requested to fill the feedback form in case they want the certificate. The certificate will be sent to all the participants by the 4th of November. We request you to please not send us any emails asking for certificate prior to this date. And once you receive the certificate in your mail, you are requested to download and save the certificate from Google Drive link as soon as you receive it. All the sessions that we had today, both Dr. Rox and Dr. Sagar's, will be available on YouTube, and you can view those in the future as well using the link that has been mailed to you already. You can also share the link with your family members or friends, whoever you would like to view to see the webinar. For our future webinars to be updated with the kind of activities that Nutrition Society of India is doing, I would urge all of you to follow us on our social media pages on Facebook as NSI Mumbai and Instagram nsi.mumbai. In case you have any other queries or you want to ask anything, you can send us an email on nsimumbai.sm@gmail.com. Furthermore, we receive a lot of questions regarding how you can become a member of the Nutrition Society of India. The headquarters of Nutrition Society of India is located at Hyderabad. And in case you want to become a member, you can log on to www.nutritionsocietyindia.org, and under the head of membership, you will find all the relevant details. Thank you so much once again for patiently listening, and I officially conclude the webinar. Thank you, everyone. Have a happy Dussehra and a great day ahead. Thank you.